Dronabinol, also known as THC, is a medication used to help with nausea and vomiting caused by cancer chemotherapy. It is typically used when other medications have not been effective in controlling these symptoms. Additionally, Dronabinol is also used to help with loss of appetite and weight loss in patients with HIV infection. It is a synthetic form of the active natural substance found in marijuana, cannabis. The recommended dosage and the best time to take Dronabinol will depend on the individual's specific medical condition and should be discussed with a healthcare professional. Before taking Dronabinol, consult the patient information leaflet from your pharmacist. If you have any questions, ask your doctor or pharmacist. Take this medication by mouth as directed by your doctor. If you are taking it to control nausea and vomiting, you may need to take it up to 4 to 6 times daily. If you are taking it to treat appetite loss, you may need to take it twice daily, before lunch and before dinner. Follow your doctor's instructions carefully. The dosage is based on your medical condition and how you respond to the treatment. If you are taking this medication to control nausea and vomiting, your dosage may also be based on your body size. Do not increase your dose or use this medication more often or for longer than prescribed, as it will not improve your condition any faster and may increase your risk of serious side effects. If you suddenly stop using this medication, you may experience withdrawal symptoms such as irritability, trouble sleeping, restlessness, hot flashes, and diarrhea. Your doctor may lower your dose slowly to help prevent withdrawal, especially if you have used Dronabinol for a long time or in high doses. Contact your doctor or pharmacist immediately if you experience withdrawal symptoms. Although this medication helps many people, it may sometimes cause addiction. The risk of addiction may be higher if you have a substance use disorder. Take this medication exactly as prescribed to lower the risk of addiction. Inform your doctor if your condition persists or worsens. When you first start taking Dronabinol, you may experience dizziness, drowsiness, confusion, feeling high, an exaggerated sense of well-being, lightheadedness, nausea, vomiting, or stomach/abdominal pain. These effects should decrease as your body gets used to the medication. To reduce the risk of dizziness and lightheadedness, make sure to get up slowly when rising from a sitting or lying position. It's important to remember that your doctor has prescribed this medication because they believe the benefits to you outweigh the potential side effects. It's common for many people to use this medication without experiencing serious side effects. However, it's important to contact your doctor right away if you experience any serious side effects, such as fainting, fast or pounding heartbeat, or mental/mood changes like anxiety, nervousness, hallucinations, or abnormal thoughts. While it's rare, a very serious allergic reaction to Dronabinol can occur. Seek medical help immediately if you notice any symptoms of a serious allergic reaction, such as rash, itching/swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so if you notice any other effects that are not listed, make sure to speak with your doctor or pharmacist. As always, if you have any concerns about the side effects of Dronabinol, don't hesitate to reach out to your doctor for advice. Before taking Dronabinol, it's important to let your doctor or pharmacist know if you are allergic to it, marijuana, or any other substances. This medication may contain inactive ingredients that could cause allergic reactions or other issues, so it's essential to discuss any concerns with your pharmacist. It's also important to discuss your medical history with your doctor or pharmacist before using this medication, especially if you have a personal or family history of substance use disorder, heart disease, high blood pressure, mental/mood disorders, or seizures. Dronabinol may cause dizziness, drowsiness, or affect your judgment, and using alcohol or marijuana can worsen these effects. It's important to avoid driving, using machinery, or anything that requires alertness until you can do so safely. Also, it's essential to avoid alcoholic beverages and discuss the use of marijuana with your doctor. Before undergoing surgery, be sure to inform your doctor or dentist about all the medications and products you are using, including prescription drugs, non-prescription drugs, and herbal products. Children may be more sensitive to the side effects of this drug, especially drowsiness and mental/mood changes, while older adults may also be more sensitive to the side effects, including drowsiness, dizziness, lightheadedness, and mental/mood changes. If you are pregnant or planning to become pregnant, it's important to inform your doctor. It's not recommended to become pregnant while using Dronabinol, as it may harm an unborn baby. If you become pregnant, it's crucial to discuss the risks and benefits of this medication with your doctor. Additionally, this medication passes into breast milk and may harm a nursing infant, so breastfeeding is not recommended while using this medication. It's important to consult your doctor before breastfeeding. It is important to be aware of potential drug interactions when taking Dronabinol. This medication may interact with other drugs, causing changes in how they work or increasing the risk of serious side effects. Be sure to keep a list of all the products you use and share it with your doctor and pharmacist. This includes prescription and non-prescription drugs, as well as herbal products. If you are taking other products that cause drowsiness, such as opioid pain or cough relievers, alcohol, marijuana, drugs for sleep or anxiety, muscle relaxants, or antihistamines, it is important to inform your doctor or pharmacist. It is also important to check the labels on all your medicines, as they may contain ingredients that cause drowsiness. Ask your pharmacist about using these products safely. When taking Dronabinol, it is crucial to follow the dosage and timing recommended by your doctor. They will be able to provide guidance on the best time to take this medication, as well as its potential benefits. If someone has taken too much Dronabinol and is experiencing serious symptoms like passing out or difficulty breathing, it's important to seek medical help immediately. In the U.S., you can call 911 or your local poison control center at 1-800-222-1222. In Canada, you can call a provincial poison control center. Symptoms of overdose may include severe drowsiness or dizziness, a fast heartbeat, changes in mental or mood, and seizures. It is important not to share Dronabinol with others, as it is against the law. It is also important to keep all medical appointments so that your doctor can monitor your response to treatment and check for any potential side effects, such as changes in weight. This will help ensure that you are receiving the proper dosage and getting the most benefit from the medication. As always, follow your doctor's instructions for the best time to take Dronabinol and the appropriate daily dosage for your specific condition. If you forget to take a dose of Dronabinol, take it as soon as you remember. If it's close to the time for your next dose, just skip the missed one. Don't take double the dose to make up for the missed one. Stick to your regular dosing schedule. When it comes to storing Dronabinol, it's important to follow the directions on the product package. Some brands may need to be refrigerated, while others can be stored at room temperature. It's best to consult with your pharmacist for more details on how to store this medication. Remember to keep it away from light and moisture, and always keep all medications out of reach of children and pets. When it comes to disposing of Dronabinol, it's important not to flush it down the toilet or pour it into a drain unless specifically instructed to do so. Properly discard this product and it is expired or no longer needed, and it's best to consult with your pharmacist or local waste disposal company for the best way to do so. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.